Welcome, everybody, to our Courageous Conversations Over Coffee. This is sponsored by South Coast Interfaith Council. And the theme this afternoon is mental health and COVID-19, suicide risk and prevention during the pandemic. We had originally planned to have the American Foundation for Suicide Prevention to come and present. However, they've had kind of a sudden event that came up that they were unable to participate today. So we actually have, in lieu of their participation, a member of our board, Merrietta Fong, who will be sharing, and I will be interviewing her. She's been facilitating these meetings and co-hosting these over the past couple of months. So we're very thankful for your leadership and support, Merrietta. And we actually have joined the board at the same time, Merrietta, and I wonder maybe you could just share a few words of be prepared to going into the interview questions. And in the meantime, I'll transition to ask Cheryl Bentz, the office manager for South Coast Interfaith Council, to go over the Zoom rules. So Cheryl.
Yes, just a minute. All right, does everybody see this on the screen? So today we're going to be, we're Zooming, but what we ask is that everybody remain muted. And if you have any questions, that at the bottom of your screen, there's a chat button. If you would send your questions to Jonas, then he will ask Merrietta. That will help with the sound quality. If we have too many people talking, it can disrupt the sound quality of the speaker. You also have the ability to raise your hand in the, it's one of the buttons down at the bottom. And if you see yourself on the camera and you're not looking as well as you would like, try to have a light in front of you and no light behind you. And as we announced at the very beginning, that we are going to be recording this session, and we'll be uploading it to our South Coast Interfaith Council YouTube channel. And please have patience with us because we're still learning this whole process. All right.
Thank you, Cheryl. And Merrietta, I think we lost your video, Merrietta. Oh, here we go. Would you share just a few words about you, just to kind of give us a context for our invitation for you to be our speaker today, and just kind of set the context for our discussion?
Sure. Okay, so for those of you who don't know me, I've lived in the South Bay here for about 36 years in the same neighborhood, and I'm a retired CPA. I retired about a year ago, and I was practicing in public accounting for about 40 years. I'm divorced and have a new partner for about the last 4 or 5 years. A member of the Rolling Hills United Methodist Church, and have been there for ages, and became involved in the South Coast Interfaith Council about a year ago because I learned of the work that the council has been doing here in the South Coast, and was just so inspired, impressed, and happy to be associated with some wonderful people. It's been a learning experience, and an experience that I'm just thrilled to have, and very grateful for. And I guess the context, as Jonas had said, is that we had hoped to have the American Foundation for Suicide Prevention with us today. I think the reason they decided at the last minute that they couldn't join us is that they're putting all their resources into an increased demand. As you might imagine, people are under unusual amounts of stress and have all kinds of mental health issues and challenges right now. And so they're putting all of their time, effort, and energy into meeting those increased demands and needs. So I'm going to share a little bit with you just from the perspective of a survivor of suicide. And by that, I don't mean that I have made suicide attempts, but a survivor of suicide is the term that they use for the ones who are left behind, so to speak, those who suffered a loss of someone that's in their family or someone who's near and dear to them, and they've had to learn, and I do mean learn, to go on after an experience like that. So I would just be happy to share with you whatever I can from my experience and from what I've learned by doing some research and being involved in some things today.
Thank you, Merrietta. And I'll open it up with a few questions. And again, for those that might be new to the discussion, I know most of our folks are returning participants, but this is about a 45-minute discussion. I'll ask the opening questions for the first 25 minutes or so, and then I'll open up the remaining 10 or 15 minutes we have left to your own questions, which you can submit to me. So, Merrietta, why is it that we're talking about suicide prevention today? That if you could give us kind of the big picture here for this discussion.
Sure, Jonas, thanks for asking. You know, we don't often think of suicide. It's not top of mind. It's something that we just don't have in view. But really, suicide, believe it or not, is the 10th leading cause of death in the United States. And the rate of suicide in 2018, for example, was 14.2 per 100,000 individuals. That doesn't sound like a lot, but that's over 48,000 people who actually died by suicide. And on average, there are 132 successful suicides each day. The rate's highest, believe it or not, in middle-aged white men. Men died by suicide 3.5 times more often than women, but adult females reported a suicide attempt 1.5 times more often than males. So that tells me that the attempts are just as devastating as, or close to just as devastating as the actual successful, call it successful, suicide, one that results in death. And the youth are quite often susceptible to mental health issues, depression, anxiety, suicide attempts. It's something that we always think it won't happen to anyone that we know. But what happened to me in one way that was eye-opening was that when I started talking about our personal experience, people opened up and related to something that they had either experienced with a family member or perhaps something in their own life. So it touches so many people. And we can talk a little bit about the risk factors. And I think you can see that the risk factors are definitely increased during a time like this, when there's so much stress, so much uncertainty, so much angst, so much anguish, and so much pain. So I think it's important for us to talk about it, to raise our own personal awareness, to raise awareness about people in our environment, and to raise awareness. Probably, I'm sure that there are segments of our population who are even more susceptible that we haven't tracked, for example, by ethnic group or socioeconomic status. So those are some very important reasons to talk about it today. And I didn't really tell you that, I don't suppose I told you about our loss, did I? I've alluded to it. Right,
yeah, and why don't, if you would share that personal experience, would you, is now a time that feels right to do that?
Sure, I can tell you what happened to us. Our family was doing really well. It seemed from the outside that everything was just beautiful, and in many ways it was. My husband and I had a daughter and a son. Our daughter was a freshman at UCLA, and our son was up at UC Berkeley. Nathan was the kind of son that anyone would be just thrilled to have, in that he was very intelligent, very responsible, kind, compassionate, wise beyond his years. He had a maturity level that was just unusual. He was the kind of person that people would come to with their problems, and he always had a word of wisdom, a word of common sense, a word of compassion, a word of calm. But he did not open up and share his own burdens and his own problems and struggles with other people. So he was up at Berkeley, freshman, sophomore year, and had some emotional problems that he didn't share with anyone. They affected his schoolwork, and he ended up failing school and not telling anyone, pretending for 2 years that he was still advancing towards his degree. At the end of that time, he led us all to believe that there would be a graduation and perhaps law school in the future, etc. So his girlfriend, who was in Boston, was planning a trip to visit, and a couple of days before she was due to arrive, he called and just chatted with everybody, just wanted to know how we were doing. Just how are you? Just tell me about what's going on with you, about your life and, you know, your mood and everything else. And then the night before she was supposed to arrive, he ended his life because he didn't want to face her. And he thought that once she arrived, that everyone would know the true situation. And he couldn't deal with the shame and humiliation that he felt would follow after the revelation that he wasn't where we thought he was. So we ended up getting a call from one of his friends who was online with him a lot. And there was a website that they communicated a lot. And he left a note on that website kind of saying goodbye in an oblique way. Whatever he said alerted his friend to call us. So we immediately called his roommate, who said, well, I don't know, he went out somewhere, but he hasn't come back and he didn't say where he was going. So we didn't know what to do, but we told him, go find him, call the police, call the campus people, I don't know what's going on, but find out. And called people who cared about him, called our daughter, etc. And after a while, we jumped in the car and just drove all night to get up there. And they had found him before we got there. He had planned it all very carefully in a way that he felt would be the least traumatic, if you want to believe that word, to the people who found him or who would have been looking for him. And he left notes to everyone, but he just left them right before he walked out the door so that they wouldn't be found in advance. So it was well thought out, well planned. And of course, it just turned our lives upside down. We were completely devastated, of course. Didn't know what to do, but loaded up some things in the car that he had left behind and turned around and drove home after making some phone calls and arrangements, and tried to pick up the pieces and just go on with our lives. So that was the experience the traumatic experience that we suffered through. And then on beyond that, it was the just going on with life, because they say whoever commits suicide leaves their problems in the hands of the ones who were left behind. And that's really true, because then you enter a period of just reflection, intense questioning. Why wasn't it me? Why is my son gone? Why wasn't it different? Why couldn't we have seen something? What could we have done? And you know, there aren't answers that will change anything about what's happened, but there are things that you learn about going forward in life and that you hope will be helpful to other people. So you tell your story, you learn as much as you can, you reach out and try to share. Long story, huh, Jonas?
Thank you, Merrietta, for sharing that. It's just such a moving, story to share with us. And I think, I know for me, I think it's an issue that touches all of us. I mean, I know a lot of individuals that struggle with depression, and I think human beings tend to either act out or act in. And sometimes when it's hard to find places where the anger can go, it turns inward. And I think there's a lot of questions that come to mind, I'm sure, as it would for all of us, but I wonder what is it that, in your experience, in that moment, in the most difficult moment as you're driving there and experiencing this, what is it that you think someone in that position, what is the most important thing for them to remember in that situation, in terms of responding with compassion and in responding in a way that, I don't know. That's my question, is what would you say is the message that should be heard
Well,
in the midst of that most despairing place?
well, the person who is afraid that they are losing someone, or who has just experienced the fact that they have or may have lost someone, there are no words for that, really. The only thing to say is you're not alone, because there are other people who have gone through this, who are going through this, and you can reach out to find empathy, compassion, and support. That turned out to be very important for us. The first thing that was comforting and reassuring, or that at least helped us to hold on to a bit of reality, was the fact that I could call someone that I knew wasn't like a family member who was also devastated, but a friend who was very, very supportive, compassionate, and a good resource. Ray Frew, who is the president of Green Hills Memorial Park at the time, was my business partner, and I immediately called Ray, and he gave me advice on some of the practical things to do, but with a tremendous amount of compassion. And of course, the second person, and maybe the first, I don't know, was our pastor. And Jonathan Chute was just there for us in the most in-depth, compassionate, understanding, and meaningful way. I can't possibly describe what that meant. And then, of course, after we came home, he spent the evening with the family, just praying with us and telling us that Nathan was in the arms of someone who loved him very much, infinitely, loved him infinitely. And we knew that was true. We could tell. It just was the most tremendous comfort to know. After that, after things kind of settled down, if you want to call it that, there are groups that are support groups. There's a group called Compassionate Friends who are there they are people who've lost children in ways that were unexpected, from a newborn all the way up through, midlife. A parent's always a parent, and Compassionate Friends was there for us. There are grief support groups. There's a group called Survivors of Suicide, that's what we are. We are survivors of suicide, and no one can understand exactly what you've gone through unless they've gone through something similar. So people may have experienced grief, but a parent experiences grief a different way. Someone who's lost a person to suicide experiences that in a very different way. So if you can find a support group that's right for you, that's tremendously important. And there are resources For the person in pain, there are resources for someone who's contemplating suicide. There are resources for almost any situation, and we'll share some of those with you before the interview is done. I know Cheryl has a couple of slides that she can share the information, and maybe we can put it in the chat box for someone. But the key is, I would think, look for the warning signs for someone who's in a tremendous amount of stress, and there are some very specific warning signs that you can be aware of. And don't be silent. If you think someone's in trouble, if you think someone might need help, speak up. We'll do whatever it takes. Reach out to them yourself. Find a friend that they'll respond to. Find a mental health professional that they don't mind connecting with that can be helpful. Just don't sit back and wait. I read an article once that touched me deeply. It was in the LA Times, and it was written by a professor who's a journalist as well, and an author. She I think the title was "Break Down the Door." And I think she'd been through a period where she was tremendously depressed and was suicidal and was closing up and not sharing that with anyone. And a friend reached out and tried to call, and she didn't answer the phone. They tried other ways to get in touch, and she didn't respond. And they literally went over and broke down her apartment door and saved her life. That's how important it is to make sure you are active in responding to someone that you think is in trouble.
Thank you, Merrietta. You know, one of the things that I've noticed in depression is that it can look very different from one person's experience to another. And so it's kind of like that old spiritual that it's sung in the churches, you've got to walk that lonesome valley by yourself, and there's a way I think that we're in community and we're supported by others, but that somehow the manifestation of that depression, I think, has looked different for different people. But still, I think there's, like you use the words warning signs, and I wonder if maybe there are some overarching warning signs that somebody asked in the chat box if you would be sharing some of these warning signs to look for so that it might prompt a response. Some might recognize those warning signs and others might not, but could you illuminate some of those for us?
Yeah, actually, the American Foundation of Suicide Prevention and several other resources, which we'll share later, they've done a lot of studies, and they've actually articulated these very well. For example, some of the warning signs include the way a person talks. If they talk about killing themselves, if they talk and say that they're feeling hopeless, they have no reason to go on, they're a burden to others. They have unbearable pain. They feel trapped. Those are some of the things that you might hear in a person's conversation that are more than sad. They are more than sad. Sometimes it's a behavior. If a person is showing withdrawal, isolating from friends and family, not going out and doing the things that they normally do that are healthy, if they're sleeping too much or not sleeping enough, if they're maybe unusually visiting people to say goodbye. They may not say goodbye, but if they don't normally go out and call on all these people, one of the reasons may be that they're saying goodbye to people and checking on everyone before they go, just like those phone calls that Nathan made before he said goodbye. Maybe they're doing online searches for methods to kill themselves. Sometimes it's the mood that you notice. If a person might be unusually depressed or anxious, maybe they've just lost interest in everything that used to matter to them. Maybe they're unusually irritable. Maybe they're going through humiliation and shame, and that's compounded by other factors. They may exhibit agitation and anger. And maybe they've been under stress and all of a sudden they seem kind of relieved. Maybe it's because they think that they are going to find relief in a way we don't want them to find it. So those are some of the things that they've found to be patterns that you should be aware of if you can.
You spoke to some of this, Merrietta, but I wonder what helped you through some of those most difficult moments. You'd mentioned the support of the spiritual leader and the pastor in that moment, but what really was critical at your deepest moment of need of support?
Well, I'll mention two things, Jonas. One is it's extremely important to get either group or individual counseling support. I went through, I don't know what it was, whether it was months or years of individual counseling with a really good counselor who helped me tremendously. Then you just pick up whatever you can from wherever you can that helps you cope with things. I think if I had to say the lessons that I learned that I carried with me besides the ones we've talked about today, you can't know what's around the next corner. You just can't. You can plan, and you should, and try to take care of things, but that's a philosophy that I've developed and carried with me. Secondly, you can't change the past because anyone in my shoes would go through a tremendous amount of self-recrimination. Why didn't I do something? Why wasn't I able to see what was going on? Why did I have a journals full of apologies about the times I let him down. You have to tell yourself, stop, stop, stop. You can't live your life in the past. You have to look forward and do as much as you can in the present moment and in the future to make the lives of those around you better. I think John Wesley is the person who inspires me tremendously in our United Methodist faith. One of his sayings that I carry is, do all the good that you can to all the people you can, in all the places you can, in all the ways that you can. I won't get it all right, but I know the ending of it is as long as ever you can. And if you hold on to something like that, that tends to give you a little bit of, I won't call it an answer of why am I still here? But okay, if I am, then this is something I have to try every day to do a little bit of. Just put one foot in front of the other and look for what God's telling you to do in whatever way you can find it. Did that answer your question a little bit?
It does. Oh, absolutely. And you know what? I have to say, this is so powerful, Merrietta. I just really, and I'll tell you that the Zoom group chat box is a lot more active than it normally is. So because of that, I wonder if some folks would mind asking some of your questions that you're putting through the Zoom chat. And I'll ask Stephen Marsh to unmute and ask his question. And then I wonder, Karen Brooks, if you're willing to stay on deck for your question, I think is a really good one. Anyway, so Steve first.
Thank you, Merrietta, so much for your vulnerability and your risk-taking today. From my perspective, you don't have to agree with that. But here's my question. My sister was murdered by her husband in 1993. That rocked the Christian worldview of both of our families. What is your counsel about how Christians might expand their boundaries to uncomfortable issues?
Oh, goodness, Steve. What a wonderful question and what a hard question. I don't know, maybe April Heron could answer it more than I could, but just from a personal perspective, if you could walk in someone else's shoes, that's just the only way to have any kind of compassion and empathy, to try your best to envision what it would be like to be in that person's shoes. And the only way to really know a little bit about that would be to talk to them, to just ask them, to just reach out and try to connect, and then really, really listen if you can. That's so much of what we're going through today with all the issues of police brutality and everything else that's happening, is just listening to each other, just listening and asking questions that elicit some kind of a response from the person that you're talking to.
Yeah. Well, thank you so much. And I agree with you. And in the whole discussion nationally and globally about issues, when we come from our particular religious perspective, there's not a lot of listening going on, even in the middle of our own traditions. So I'm grateful for your authenticity. I want to thank you for that. And it's lonely, at least in my world, it's lonely. I won't put that on you, but thank you so much.
Thank you, Steve. Karen, would you ask you have to unmute yourself, I believe. Oh, hold on a second. You're not quite there yet. Are you able to do it on your end? Oh, there you go, Karen. You got it.
Okay. You can hear me?
Yes.
Oh, okay. This was many, many, many years ago when I had a roommate, and I was working on my master's in counseling. So I had some idea, about suicide, but my roommate was extremely depressed, had been very depressed, had actually made prior suicide attempts before we were roommates. And once we were roommates, for many, many years, I was always worried that I would come home and actually find her dead. She was on antidepressant medication. She was in therapy. A few times I even had to call the police for them to do a 5150 on her because she was that close to committing suicide. But, and to this day, I'm really not quite sure if I could have done things differently. I even tried to sit her down. I remember we were at the kitchen table and I said, Barbara, this is just so stressful for me too, because I don't know day to day what I'm going to come home and find. And I tried to set up like a contract with her that she wouldn't commit suicide while we were roommates. And of course she couldn't agree to anything like that. She did not commit suicide while we were roommates, but a few years later, she almost did successfully hang herself. But I can say now, many years later, she's doing much better. But, even being a mental health professional, I'm still not quite sure what I could have done differently in that situation. I mean, it was not a topic that we shied away from talking about, but I didn't, other than sometimes calling her therapist when she was obviously really upset, and the police. I don't know what more I could have done, and I'd like your perspective.
Karen, I think that she had a great gift in that she felt she could talk to you. That is, from my experience and perspective, is the most important thing, is to have someone that is in your life that you can honestly confide in and talk to. And it's a struggle from some of the other parents that I've talked to who had children or family members who just struggled with it constantly and who had multiple attempts. At least there's the knowledge that the struggle exists, and at least there are attempts to help the person. And it's a day-to-day battle sometimes. A person can be in a good place for a long period of time and then start struggling again. And no one knows the answer to what I could have done differently. Believe me, if there were answers like that, I would have found them in my own life. I can think of a lot of things that I think I should have done that would have made a difference, and maybe they would have, but who knows? You just do the best you can, and it sounds like you were very actively engaged with her. That's key. If you can get someone to talk, get someone to get professional help, find
Yes.
whatever support is appropriate, and then someone who's actively engaged with them and aware of their struggle.
Mhm.
That's a lot. That's a lot.
Thank you.
Let's see. Sarah Dean has a question.
Sure. Merrietta,
Sarah.
thank you so much. You're one of my favorite people, and it's because you just ooze this open, unconditional compassion. But hearing you share so vulnerably, it's really inspiring and moving. And it reminds me of that Rumi quote that the wound is where the light shines through, and certainly you bring a lot of light with you, so thank you. My question is, I have a friend whose sibling committed suicide many years ago, probably 25, 30 years ago. The sibling that was left behind is still acutely angry. Feels like the sibling that committed suicide abandoned them. Has not sought any therapy that I know of. Is this have you heard of this, to be angry with the person? And I don't know if you have any suggestions. And then my second question is, because that's a sibling, and then I was thinking about what you were saying, that as a parent, whenever there's something that doesn't go wonderfully for our kids, whether it's something small or big, as parents, we always, focus on what we could have done better. And that cycle of blame can be very trapping. How does one get past that? So anger and blame, I guess, are my two questions.
Well, I think the blame, especially the self-blame, you really never completely get over it. All you can do is just tell yourself over and over and over again, you did the best you could with what you knew at the time and the tools and resources that you had. And that's true. I mean, you did the best you could. Was it good enough? Well, of course not. By your own standards, by anybody's standards, you can't say it was good enough, but it was the best you could have done. And that's all there is to it for the blame. As far as the anger, that is quite common. And in fact, I remember our own pastor telling me that he felt quite angry at my son. And I felt no anger whatsoever because I loved him so much that how can you be angry with someone whose pain is so great that they have no alternative in their mind but to escape? If I could have taken it on myself, I would have. But I didn't have that chance. I didn't have that option. So how could I possibly be angry with him? And that's a perspective that's hard for some people to get to. The only thing really, I think, that can defeat anger is love. That's it.
Thank you, Merrietta. We love you.
I love you too, Sarah.
Very powerful, Merrietta. I just think I'm trying to think of what my closing kind of question might be, because I think we've all the questions, or most of the questions, I think, that came out of the chat box, we've been able to ask. But when it comes to grief, and I think I think about as a pastor, you know, a lot of ministry is grief support because we're all grieving in some way. And I remember as a young chaplain, my chaplain supervisor, when I was in San Francisco working with patients at California Pacific Medical Center, said, you can only go as far with your patients as you have gone internally, doing your own inner spiritual work. And I think that's so true. So if we were for some reason working with a patient in the hospital and they were experiencing something and for some reason we couldn't work through it, or we couldn't connect or something felt off, that was often a sign that we were brushing up against some inner work that we ourselves had not done, which was illuminating and very uncomfortable, you know. And I just think about, it's really hard sometimes to compare one person's grief to another. And that's why I love, maybe it's because I grew up in Missouri, but I always like Mark Twain, you know, and Mark Twain said something to the effect of, nothing that grieves us can be called little. By the eternal laws of proportion, a child's loss of a doll and a king's loss of a crown are events of the same size, you know? And so, I mean, that communicates that sometimes we think about that child's rattle. How can you compare that to the king's crown? Well, gosh, I mean, that's a substantial loss. And so I wonder if you just, in terms of people that we engage now that are grieving, what do you think are the most important things we can do for someone who's experiencing intense depression? Like if we were just to have like a few takeaways, and you've already shared a lot, but I just wonder if we just can think about some actionables of what are some important things for somebody that's really experiencing depression. What would you say are the most important things for us to keep in mind?
Well, I'm going to also share something else, Jonas, and that is that in sharing this and in you allowing me to be vulnerable and to share with you what little I know from my own personal perspective, that's a gift. It's a gift that you give me, and it's a gift that we can give to each other. It's funny, now that I have been sharing this story, and I shared it a lot in the first 5 to 10 years after this happened, because it's been 17 years ago, people shared stories with me too, because I was open and vulnerable in sharing with them. And I said to our pastor once, I said, Jonathan, I for years I've been up in the choir and looking out at the congregation and thinking how blessed we are. And now I know all these struggles and wounds that people have because they've shared things with me that I never would have guessed. And I must know a tenth of what you know. How in the world do you stand up there in front of this group of people and not just cry every time you're in front of them? And he said something I'll never forget. He said, I look out and yes, I see pain and wounds and suffering and grief, but I also see the grace, the courage, and the compassion that they have for each other. And that's wonderful, that's nourishing. So in every single moment, and this is going to sound trite if you're going through something really tough, but in every single moment there is hope. In every single moment there is some essence of tomorrow. So that's something that you just have to look for and find in however you can find. And I'll also say that Cheryl has a couple of screens that she's going to share before we go with some resources for people. So Jonas, I'll let you decide when the appropriate time is for her to share those, but I don't want to end this without people having access to some of those websites and resources.
Well, yeah, you've answered my question, I think, too, what that message of hope in every situation and some really good takeaways. So thank you so much. Cheryl, would you share the slides with the information? Yeah, please.
Sure.
Yeah, I think there are two of them. One of them, and you're going to have to make it a lot bigger.
Okay.
This one is, it's called action items. If you're worried about someone, these are the things that you can and should try to do. I don't know if you can see those. Do you want me to read those out loud, Jonas?
Yeah, I mean, it's a lot of text there, but you know what? There are people that are on the call that don't have video. So why don't you at least summarize and give the high points?
Sure. The first one is ask. Just ask. Are you thinking about killing yourself? That's not an easy question, but studies show that asking an at-risk individual if they're suicidal does not increase the suicide or suicidal thoughts. It may be what stops the action. Second, keep them safe. If you really think that someone's suicidal, you have to restrict their access to the means and ask them if they have a plan, and then take away whatever it would take to get that done. Third, and very important, just be there and listen. Listen carefully, learn what they're thinking and feeling, and get them to acknowledge and talk about it, and that reduces suicidal thoughts rather than increase them. Help them connect. We're going to share some resources to some of these hotlines, and stay connected. Don't think this is over and done with. Stay in touch after a crisis. Even after they've had some professional help, they need someone in their lives that will stay in touch and check on them and just take care of them. So that's the basic 5 things that you can do. And I think Cheryl has another slide she can share with some of the lifelines, places that you can call. There we go. Yeah, so there's the National Suicide Prevention Line, 800-273-TALK. Or you can even text TALK to 741-741. And then, of course, this Suicide Prevention Lifeline has different topics. Helping someone else, talking to someone right now, helping yourself, and crisis centers. Then there's the crisis text line that I mentioned. You can either text TALK or hello or home to 741-741. And then the American Foundation for Suicide Prevention. If you just find their website, afsp.org, it's easy to find the different options, how to help someone who needs help, how to find help if you've lost someone, how to help someone at risk, how to help someone after they've made an attempt. So those are helpful resources to keep handy if you can.
Those are great, Merrietta. And you know, would you be able to send those slides to the participants that are on this call? Because there is so much text and information. I know that they'd like to save the links and the phone numbers. Would that be easy to do, Cheryl?
I can do that. Yes, thank you. I can do
Okay. Very good. Well, gosh, I think we're at time, but this was such a powerful conversation. And Merrietta, thank you very much. And we will be meeting again next Friday at 3 o'clock in the afternoon. We don't have the flyer for that program yet, so just keep your eyes peeled, and we will share it when it's ready.